Have you ever wondered how to interpret an ECG? The electrocardiogram, commonly known as ECG, is a crucial tool in modern medicine. It tells us the story of the heart, its rhythm, its pace, and any potential abnormalities. In the world of healthcare, understanding this narrative is paramount. But don't be daunted. The art of reading an ECG can be mastered with time and practice. It's all about breaking it down into manageable steps. Interpreting an ECG is not as complex as it seems when you break it down into steps. Before we delve into the interpretation, familiarizing ourselves with the basics of an ECG is crucial. An ECG, or electrocardiogram, is a simple, painless test that measures the heart's electrical activity. It's represented in waves and complexes on a graph. The first wave we see is the P wave, which represents the electrical impulse traveling through the atria, causing them to contract and pump blood into the ventricles. Following the P wave, we have the QRS complex, a quick, sharp set of waves that represent the rapid depolarization of the ventricles as they contract and pump blood out to the body. Finally, we have the T wave, which represents the ventricles resetting and getting ready for the next beat. Each of these components provides vital information about the heart's rhythm and function. Now that you understand the basics, it's time to learn how to interpret an ECG. Scene script. Ready to learn how to interpret an ECG? Here we go. Interpreting an ECG may seem daunting at first, but once you understand the process, it's like solving a puzzle piece by piece. So let's break it down into manageable steps. First up, identifying the rhythm. This is the foundation of your interpretation. Is the rhythm regular or irregular? To determine this, simply look at the RR intervals. If the intervals are evenly spaced, the rhythm is regular. If they vary, it's irregular. Now let's calculate the heart rate. An ECG machine often provides this, but it's important to know how to do it manually. Count the number of QRS complexes in a 6-second strip and multiply by 10. This gives you the heart rate per minute. Next, assess the P wave. It's the first small upward wave that signifies the start of the cardiac cycle. Is it present? Is it smooth, rounded, and upright? If yes, that's a good sign. If not, it might indicate an atrial problem. Moving on to the PR interval, the time from the start of the P wave to the start of the QRS complex. It should be between 3 and 5 small squares. Anything outside this range could mean a conduction delay or block. Now let's evaluate the QRS complex. It represents ventricular depolarization and should be narrow, usually less than 3 small squares. A wider QRS complex might suggest a bundle branch block or ventricular rhythm. Finally, analyze the ST segment and T wave. The ST segment should be flat and the T wave should be rounded. Deviation from the baseline in the ST segment or an abnormal T wave may indicate myocardial infarction or ischemia. Remember, practice makes perfect. The more ECGs you interpret, the more comfortable you'll become with the process. And always correlate your findings with the patient's clinical condition. There you have it, a step-by-step guide to interpreting an ECG. Remember, practice makes perfect when it comes to ECG interpretation. That's our mantra as we delve into the key points of this essential medical skill. Firstly, always start with the basics. Identify the rhythm, measure the heart rate, and assess the P waves, QRS complexes, and T waves. These steps form the foundation of any ECG interpretation. Secondly, contextualize the findings. ECG data doesn't exist in a vacuum. It's part of a larger story. Understanding a patient's clinical history and current symptoms can provide invaluable insights into the story your ECG is telling. Lastly, it's important to be thorough. A comprehensive interpretation of an ECG involves more than just looking at the waves and intervals. It's about piecing together the puzzle of the patient's cardiac status, which requires careful consideration and meticulous evaluation. Interpreting an ECG is a skill that improves with practice, so keep at it. And remember, every heartbeat tells a story. It's up to us to listen. So there you have it, a comprehensive guide to interpreting an ECG. We've explored the basics, delved into the details, and highlighted key points to remember. But remember, this is just the beginning. Practice is your best teacher. Dive into ECG readings, challenge yourself with more complex interpretations. As you continue to learn and refine your skills, you'll unlock a deeper understanding of the heart's language. Remember, accurate ECG interpretation could be a life-saving skill. Never stop learning and practicing. And